actually received a letter from your end inviting the Secretary to come and give a short talk on what Formula One class is. But the Secretary couldn't make it this morning. Of course, he didn't have any other choice but to send somebody else to talk about Formula One class. I was able to catch on what Dr. Beaver was discussing a while ago. Yeah, he actually did mention something about universal health care. And Dr. Garcia was mentioning about the practice as well. And I'm glad from the industry naman, I heard the talk of Dr. Ms. Gades from Johnson & Johnson. Now, how will their talk now complement on what the Department of Health wants to do as far as delivering universal health care? Our dream is that every Filipino should not have a problem now when we talk about health. Out-of-pocket expenses should not be a concern, should not be an issue, because the government will be there to provide assistance. But currently, though, the Department of Health is facing a lot of challenges. And I'm pretty sure you know some of these challenges, which actually hinder some of our deliverables like vaccine. We wanted to achieve, say, 100% coverage of a fully immunized child, but then the numbers has been dwindling down simply because of the effect of that is being raised by certain concerned group. But then I won't be talking too much about that. But what I'm going to discuss with you now is how will the Formula One class complement now the universal health care? Just to walk you through some of the milestones within the Department of Health or the health sector reform. In 1991, the Local Government Code Act was signed. Now, how did this affect our system? The health system in the Philippines is default, meaning the Department of Health will only have direct control up until our regional offices. The local government unit are the ones who actually gets to provide guidance now or directions to the local government units through the municipal health officers and the provincial health officers. What does this mean? When there's an outbreak, who's supposed to be liable with that outbreak? Is it the local government unit or the Department of Health? Frankly speaking, it should be the local government unit, because we do not have any direct control to the community. Our implementers are the local government unit, but they can actually make some changes based on how they perceive things and how they think it should be implemented in their areas. The National Health Insurance Act was signed in 1995, and through Secretary Dairit, we had our first health sector reform agenda. And during the first term of Secretary Duque, 2005 up until 2010, we had the Formula One for Health, of which we only had the 4 pillars. And there's 1+1 now, just to be aligned with the millennials version 1, 1+. That's why we did change the 5 mula, or instead of formula, we retained the Formula 1, then plus. The Universal Health Care 2011 to Secretary Ona, and our current administration, the Philippine Health Agenda. What is our current situation? As far as the expenditure is concerned, the sin tax incremental revenue for health exponentially increased the fiscal space for health. Our coverage for Philippine Health Insurance, the PhilHealth, has grown from 51% in 2010 to about 91% in 2016, and currently in 2018, we're up to 97%. Hopefully before this term ends, if you're a Filipino, being a member of PhilHealth should not be a problem anymore. Rising total expenditures from 381 billion in 2010 to 655 billion in 2016. Now, despite improvement in health expenditures, improvement in health outcome has been marginal. We still have problems in delivering what we should deliver as far as the Department of Health is concerned. Now, we talk about just some samples here. We talk about infant mortality rates from 25 per 1,000 live births in 2008 to about 21 per 1,000 live births in 2017. In a span of 10 years, we did not see much improvement, from 25 only up to 21. Percent of children under 5 who are stunted from 32.3 in 2008 to 33.4 in 2015. There are more children now who are stunted. What does it mean? People may not be aware of the importance of nutrition. They will say we have problems as far as food is concerned. Mothers are too busy with their work and wouldn't pay much attention to their children, or probably the sector was not able to deliver what they should be able to deliver. Number 3, percent of children aged 12 to 23 months given all basic vaccinations. We're good at 2008 at 79.5, but in 2017 we went down to 69.9, and now in 2018, because of some concerns on vaccines, it went much lower, probably it's at 50% in 2018. The National Health Insurance Program support value is at roughly at around 50%. Now, Philippines remains to be deeply underserved. When you talk about health outcomes, the high infant child maternal mortality rates, especially among the poor, 1 out of 3 children remains to be stunted, and immunization of children is lowest in 25 years at 60%. Now, for financial risk, out-of-pocket expenses is at 56% of total health expenditures in 2014, and compliance to no balance billing for indigent and sponsor members at 60%. Our dream is that when you go to a hospital, the social worker, the hospital wouldn't be asking anymore, are you a member of PhilHealth? Our dream is that for every Filipinos going to the hospital, it should not be an issue anymore, because you are all automatically a member of PhilHealth. So out-of-pocket expenses should not be an issue anymore. 1.5 million Filipinos pushed to poverty from access to health services. Their concern will be, I didn't go to the facility, I didn't go to the health center because I didn't have any money to spend. That should not be an issue anymore. The health system responsiveness and equitable distribution of health workers, government health facilities remain overcrowded. We still have Filipinos dying without seeing a doctor. Hard-to-reach areas, no facilities, no doctors who want to work in these areas, no nurses who take the opportunity. There will be plenty of items available, but then no graduates. We're looking at it now. We're looking at enticing now new graduates of state universities, who are called the education is provided by the country to provide some return services to the country. Significant increase in physical space for health only marginally improve outcomes. Inequity persists in both access to essential health services and health outcomes across regions and provinces as well as socioeconomic quantiles. There is fragmentation of the health system after devolution with blurred accountability. Our aim is to attain the goals outlined in the PDP 2017 to 2022, the Sustainable Development Goal of 2030, and hopefully by 2014, the Ambition natin goals by this current administration. We are building on the concept of Formula 1 for Health in 2005 till 2010, the first term where we had Secretary Duque, and a medium-term strategic framework of 2017 to 2022 for this administration, which expands the 4 pillars and emphasizes performance accountability towards the Filipino people. We had the 4 pillars then back in 2025, but it was accountable for say, 1 pillar being not able to be delivered to the people. We're looking at that now. That's why we added the performance accountability. Sorry for this busy slide, but I just wanted to show you on how do we connect all these 4 pillars for us to be able to achieve our vision. Our 4 pillars, we have the financing, service delivery, regulation, and governance. Of course, the 1 plus is the performance accountability, all answering to our strategic goal, eventually our core values, mission, and vision of the Department of Health. Let me walk you through now the 4 pillars. First will be the financing. Our goal of the financing is to secure sustainable investments to improve health outcomes and ensure efficient and equitable use of health resources. There are 3 strategic objectives within the financing pillar. 1 is efficiently mobilize and distribute more resources for health. Number 2 is rationalize health spending. And number 3, focus financial resources towards high-impact interventions. But currently, you may have heard about this, we were given a slash on our budget, where we have problems now as far as personnel are concerned. We also have problems on improvement of our health facilities. But then the Senate is working on it. Hopefully by next week, we will have our plenary budget hearing in the Senate, and they're pressuring DBM to give it back to the Department of Health. Because while we have problems in human resources, and they're slashing out our budget on human resources, how are we going to achieve that one? For service delivery, our goal is to ensure the accessibility of essential quality health services at appropriate levels of care. There are 4 strategic objectives here. 1, access to quality essential health products and services. Ensure equitable access to health facilities. Ensure equitable distribution of human resources for health, and engage service delivery networks. Yesterday, we were discussing about human resources. How do we engage our doctors? How do we entice our new graduates? We're coming out with exciting plans for them. For new graduates, we have the doctors of the barrio. While volunteering, it's not actually a volunteer work. They get to receive the same salary as what we get to receive in the national office. We are offering masteral as well. So while doing DTTB, they end up after their 2 years contract also with a master's degree, and they'll be given priority as well if so they decided to go into residency training in our government facility. That's just one of our plans. Of course, if you're providing medicine, we do not choose, we do not label. Whether you're rich or poor, all of you will have equal access to whatever services are being provided by the government, more so by the Department of Health. For regulation now, our goal is to ensure high quality and affordable health products, devices, facilities, and services. There are 2 strategic objectives here: harmonize and streamline regulatory system and processes, innovative regulatory mechanism for equitable distribution of quality and affordable health goods and services. We're facing a lot of problems in regulation. We actually did close one facility because that facility was not registered to admit cases. That facility was only open for outpatient services. But then they get to admit cases. And we're facing a lot of trials now. We're being bombarded by a lot of issues. Why do we close such facility where in fact it gets to provide services to a lot of Filipinos, especially to cancer patients? We also stopped temporarily though their selling of their products because it's not registered. We just want them to register their product. It doesn't have any CPR. Once it's registered, we do not see any reason why they should not be able to market that certain product. We're talking about regulations here. Who is accountable? Something goes wrong, people will blame the government for not taking any action. We close the facility, people would also blame the government for closing that facility. We just wanted everything to be in its proper places. For governance, our goal is to strengthen leadership and management capacities, coordination and support mechanisms necessary to ensure functional, people-centered, and participatory health systems. There are 4 strategic objectives under the governance pillar: strengthen sectoral leadership and management, improve organizational development and management, improve processes for procurement and supply chain management, ensure generation and use of evidence in health policy development and decision making. There should not be an issue anymore wherein we got stuck out of medicines. There should be a very good planning. Medicine should be available all year round. Should it be an issue? We were not able to provide this medicine because we ran out of this stuff. It should not be a concern anymore. And of course, I said a while ago, while we get to look into the 4 pillars, the main question here is, who's accountable? Who do we chase if we do not provide these services? Under the performance accountability, the goal is to use management systems to drive better execution of policies and programs in the Department of Health by ensuring its responsibility to all stakeholders. There are 2 strategic objectives here: improve transparency and accountability, shift to outcome-based management approach. Currently, we have the cascading workshop ongoing at the Department of Health. We're discussing it with our regional offices, our hospitals, government facilities, our development partners like WHO, USAID, UNICEF, and also the local government units. We developed the scorecards. We came up with the scorecards. The scorecards were actually based as well on the agreements with these partners. How do we monitor you? How do we make sure that we get to deliver what is expected from you guys? These things we get to do on an all-year-round basis and see at the end of the year were we able to achieve on what we wanted to do and what we wanted to have as far as delivering services to the Filipino people. Our implementing guideline here is one. All DOH units should align their policies, programs, activities to the F1 Plus for Health. All national government agencies or entities with funds and activities related to health is strongly encouraged to align its policies, programs, and funds for health with the F1 Plus for Health. Use the performance governance system along with other performance management systems such as the quality management system, integrity management program, strategic performance management system for F1 Plus for Health implementation, the national objective for health to supplement the F1 Plus for Health, and performance scorecards stratified to different levels shall be developed to ensure accountability for all stakeholders. You might be asking now, why am I hearing this? Do I play a role here? Yes, you do. It's a shared responsibility. The government cannot deliver this alone. We need to work together for us to be able to deliver this and come out with a better health for our Filipinos. Maraming salamat po.